Incentive Spirometer is a device used to help you keep your lungs healthy. Using the Incentive Spirometer teaches you how to take a slow, deep breaths and help your lungs recover after surgery or a lung illness. The purpose of Incentive Spirometer is to facilitate a sustained, slow, deep breath. Incentive Spirometer is designed to mimic natural sighing by encouraging patients to take slow, deep breaths. Spirometry is performed using devices which provide visual cues to the patient that the desired flow or volume has been achieved. Where to use? Therapists demonstrate using a separate device and provides an information sheet regarding technique, prescription of use, and cleaning advice based on manufacturer's instruction. Patients should be in relaxed position suitable for deep breathing, sitting upright in a chair or side lying if extra volume is required in one lung due to ventilation perfusion matching. Patient creates a tight seal around the mouthpiece and inhales deeply and slowly. The patient watches the slow flow meter for visual feedback if possible. The patient sustains an inhalation to create an inspiratory hold, and ideally the inhalation is sustained for 4 to 5 seconds. Patient relaxed seal around the mouthpiece and exhales. Normal breathing is resumed with relaxed shoulder girdle.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to do a quick NCLEX review over the Incentive Spirometer. And as always, over here on the side or down in the description below, you can access the resources that goes along with this video. So let's get started. First, let's talk about the learning objectives of what I want you to learn from this lecture. I want you to learn what an incentive spirometer is, how to use it so you can educate your patient, which I'm going to do a demonstration and walk you step by step on how to do that. And then at the end, I'm going to go over an NCLEX style question of what you could expect to be asked in your nursing lecture exam or on the NCLEX about an incentive spirometer. So first, let's talk about the definition of what an incentive spirometer is, also known as an IS. The definition is that it's a device that encourages slow, long, deep breaths to help pop open the alveoli sacs, which helps move secretions and keeps the sacs working, because the biggest problem with a lot of patients who need to use an incentive spirometer is that these sacs have become deflated, which we'll go over the cause here in a second. So we want to prevent that or help treat that to help get those sacs improving their function. So it's used with helping with the prevention, or if a patient's experiencing this with a condition called atelectasis. And a lot of patients who are going for surgery or after surgery, especially like thoracic or chest or abdominal, we want to encourage them to use this device. It's a little device that seems like it wouldn't have a significance to it, but it really does, and it really works. Another reason we would use this device is to help patients with breathing disorders, such as COPD, because this helps increase their lung function. I've had a lot of patients who have severe COPD, but they regularly use their incentive spirometer every day, and they report that they can breathe better and they can tolerate more activities compared to whenever they're not using their incentive spirometer regularly. Also, if a patient has pneumonia, one of the first things I would like to do whenever my patient has pneumonia is get them an incentive spirometer and educate them how to use that, because what's going on with pneumonia, you have nasty pus infection going on in these alveolar sacs and the bronchioles, and we want to help move that out, keep that lung function going, and pop those open. So the big goal with this incentive spirometer is to inflate, get those alveolar sacs working back, and to keep that patient regularly deep breathing. Now let's talk about lung anatomy, and specifically what is happening in the lungs whenever a patient is experiencing atelectasis, because this is one of the main reasons we want to educate a patient to use incentive spirometer. So what happens is whenever you're breathing, you have air that you've breathed in go down through your trachea, down through your bronchus, into your right and left bronchi, which branch off into that, and then you have your bronchioles, and then it flows down into your alveolar sacs. And in those sacs is where the gas exchange occurs, and these sacs are constantly inflating and deflating as the air flows in and flows out. But what can happen, as you see with this little alveolar sac, he's pitiful, he is collapsed. What's happened is that in these bronchioles, some fluid or a mucus plug or maybe a tumor can get in there. And the air, as you see with the blue arrow, is trying to flow into there and it can't. It's stopped by that blockage, so that sac becomes deflated. Now, what you want it to look like is this. Nice and inflated, the air exchange is just passing through really nicely. Now, atelectasis, the definition is that you have a lung or part of it has collapsed, and those alveolar sacs are unable to inflate and deflate and perform the gas exchange. And again, like I said earlier, this is very common after surgery, especially after abdominal or thorax surgery. So, as the nurse, we want to educate our patients before they're going for surgery because they are at risk for this. Now let's talk about your role as a nurse with an incentive spirometer. Okay, big role is that we're going to educate our patient how to use it and stress to them the importance, because a lot of times patients see this little device and they're like, what in the world is that going to do for me? But like I said at the beginning, it looks insignificant, but it is a very important device, so we need to educate them how to use it. Also, monitoring, we need to monitor the lung sounds and make sure we're having improvement. For instance, if you're educating your patient how to use this device for pneumonia, monitor those breath sounds. Like at the beginning of the shift, they sounded really bad, but you encourage them to use an incentive spirometer throughout the day. And was there improvement? Do those lungs sound better? Next, observe the patient meeting their goal and make sure they're using it right. Because a lot of times whenever patients want to use this device, they either want to use it really fast, which I'll demonstrate for you, or they just want to blow into it and they use it incorrectly and they're not getting the full usage out of it. So it's important you observe that they're using it right and that they're meeting the goal that the physician has ordered for it to be. And how are goals figured out? Because as you can see on the incentive spirometer, we'll go over the layout of it. There's little areas that are measured in milliliters of how much the patient should pull whenever they're sucking in. And it's based on a patient's height and their age. So just for comparison, for instance, a male patient who's 5'8", who's age 30 should pull about 3,150 milliliters compared to a female who's the same height, the same age, will pull about 2,900. So it varies based on patient's age and their height.
Preoperative screening of patient at risk of post-operative complication to obtain a baseline of their inspiratory flow and volume. Presence of pulmonary atelectasis, condition predisposing to atelectasis such as abdominal or thoracic surgery, prolonged bed rest, surgery in patient with COPD, presence of thoracic or abdominal blinders, lack of pain control. Restrictive lung disease associated with dysfunctional diaphragm or involving respiratory musculature. Patients with inspiratory capacity than 2.5 liters, patients with pneumomuscular disease or spinal cord injury. Nursing contraindication. The contraindication are patients who cannot use the device appropriately or require supervision at all times. Patients who are not compliant or do not understand or demonstrate proper use of the device. Very young patient or pediatric with developmental delay, hyperventilation, hypoxemia secondary to interrupt oxygen therapy, or over fatigue, patients to take deeply effectively due to pain, diaphragmatic dysfunction, or opiate analgesia. Patients who are heavily sedated or comatose, this device is suitable for people with dyspnea. Certain precautions need to be taken with using the spirometer. The technique is inappropriate as the sole treatment for the major lung collapse or consolidation. Hyperventilation may result for improper technique. There is a potential or barotrauma in emphysematous lungs. Discomfort may occur secondary to uncontrolled pain. Developmental of bronchasa may occur in suitable patient. Closing monitor of patient with hyperactive airways should be maintained. For more further explanation, your incentive spirometer is a tool that will keep your lungs healthy after surgery. Surgery and anesthesia can lead to less activity in the lung, which can put you at risk for pneumonia. The incentive spirometer helps you to protect you by expanding and exercising your lung capacity. You will use this tool regularly while in the hospital after surgery, and we want you to practice using it at home in preparation for your visit. The incentive spirometer has a mouthpiece, a main chamber with a piston, and a gold marker to show your progress. It also has a flow indicator to help you inhale at the correct rate. To use the incentive spirometer, sit as far as you can on the edge of your bed or in a chair. Hold the incentive spirometer upright with a good, better, best label facing you. Exhale fully before you begin. Place the mouthpiece in your mouth and seal your lips tightly around it. Breathe in as slowly as deeply as possible, then we will rise the piston in the main chamber. Try to keep the flow indicator, the better or the best position throughout your entire breath. The marker tab shows you the target that the doctor wants you to raise your piston each time you use the incentive spirometer. At the end of your inhalation, hold your breath for at least 5 seconds, allowing the piston fall back to zero. Take your time and slow down if you begin to feel lightheaded. Try practicing at home to get your lungs ready for surgery and help prevent pneumonia. It is recommended that you use your incentive spirometer 4 times a day. Inhale 10 times each practice session before meal and then right before bedtime. Overall, the incentive spirometer is a device that helps improve lung function and prevent atelectasis. Atelectasis is where the lung of part of it has collapsed and the alveoli sacs are unable to perform gas exchange. This is very common for patient and complication after surgery. Also, an incentive spirometer encourages the patient regularly to deep breath, which helps to keep alveoli sacs open. The alveoli sacs are responsible for gas exchange, and if they become affected, gas exchange will be significantly decreased.